And we're live. Hi, everyone. Coach Kayla here again. I have another interviewee, which is so awesome. I don't think I usually don't have this many interviews. And this week I have packed my week with interviews, but it's been so awesome. So I'm so excited to be here today and talk with Corissa. And she is going to talk about and discuss brain health as it's related to plant-based eating as well as running. So I'm so excited to get started and learn more, and hopefully everyone else will learn a lot as well. So just before we get started, just a reminder for everyone, make sure to allow StreamYard to allow your name to show up in the comments. So there is a link above, just click that link. And then we'll answer questions either throughout or afterwards, and just let us know if you're here. Say hi, we wanna know that you're on. And then if you're watching on replay, just tell us you're watching it on replay. Hi, Kayla and Corissa, hi. Joyce is on. So see, sometimes it shows Facebook user if they don't allow StreamYard to show your name. So can't always see it is. But Joyce is on. Yay! So we have a couple people on.
Cool.
Awesome. All right, cool. So yeah, so let's see. Let's start with, telling us about yourself and what you're doing now. And
Sure, absolutely. Glad to be here. So I am a registered dietitian. I became a dietitian first in my career. And I think it was, my love for health and prevention and all those things led me to that field. I was always athletic and really into, healthy eating and stuff like that. And, when I started in the field, what I think was kind of, first of all, like disappointing in the very beginning is that prevention is a little hard. It's a little bit of a hard sell, right? A lot of people are waiting until they have the diagnosis or the chronic illness before they start making some changes. And so, once I kind of realized that, I still wanted to stay in this prevention space, and I was exposed to physical therapy. And so I thought, I volunteered in a clinic, and I really felt like that was kind of my calling. So I went on to get my doctorate in physical therapy, and I thought, well, if I can't get to the prevention, I'll help them recover and get back to their lives and get back to feeling healthy again. And so throughout my career, I've incorporated the nutrition piece because it's so important in physical therapy. And I think it's a big gap that we see is that in physical therapy clinics that we're not really, working together often. And it really is a huge part of injury recovery is what you're putting in your body. And so I've always kind of, melded the two. But, as I've gotten further in my career, I really just still felt this love for prevention. And, I work in a hospital, and I would see people, just with chronic illnesses that really could have been prevented by lifestyle changes. And we know that there's, a lot of research that points to our diet, our physical activity, and how we can prevent or even reverse a lot of these things. And so, so I decided that, I'm going to jump back into the prevention, and there are people out there like me and people that want to learn those things. And also people who have already been diagnosed with something that say, you know what, I want to, get healthy. I want to make better choices. And so that's kind of how I kind of went into this space. And I really became very interested in brain health. I've worked with a lot of patients that have been diagnosed with dementia and Alzheimer's. And what I was finding, especially in the hospital setting, if people don't really know, like with physical therapy in an acute care setting, really a big part of our job is to go in and really determine, is this person functional, able to go home safely? And what I was seeing a lot is that as individuals are getting older, that they were either having problems with memory or they were having problems with balance, falling. And those were the things that kept people from staying independent and staying in their own homes. And so I just, I kind of fell in love with this aging in place and how do we help keep our minds sharp and keep our bodies functioning well to do our everyday tasks. And so that's why I became very interested in the brain health piece and, more functional type of exercise, in addition to cardiovascular, because I'm a runner myself. And so, and I think as runners, you probably can definitely relate, is a lot of times your whole world is running. And I know you're a big proponent of
Mhm.
incorporating strength training, incorporating, all these other things, but we can get
Yes.
so laser focused on running, running, running. And,
Mhm.
so building in some of those other exercises, and also doing an area that I discovered was brain health training. So doing more,
Hmm.
when you're doing strength training and functional training, in addition to running, if you are, if you are a runner or an endurance athlete, and incorporating some cognitive tasks while you're doing your exercise has been shown to help with attention and memory and, more executive functioning type things, like with our, problem solving and planning and things like that. So,
Mhm.
so that's kind of where I'm at now, and, really loving being in this space and helping people to age well,
Yeah. Yeah, that's so cool. Yeah, it's so important. I think I've seen that a lot even in my family. My grandparents are getting to the age where they're getting Alzheimer's and these things, and it's
Hmm.
definitely, yeah, it's definitely very interesting. Like, how can we prevent that? How can we also add that on to what we're already doing? But I think that's a really good point. It's like, what are we doing to exercise our minds? We're exercising our bodies, we're fueling our bodies with the right nutrition, but we can't neglect our minds.
Right, exactly. And with dementia, we know that there is no cure, but the
Yeah.
studies are really pointing toward lowering your risk through lifestyle, changes. And actually, I watched your interview with Ellen. Was it
Yeah,
last night?
last
Was it last
night.
night?
Yeah,
And man, what an inspiration! I mean,
yeah,
if you guys haven't
it's
watched that, go back and
awesome.
watch that.
Yeah, absolutely, it
But
was great.
yeah, and it's just, I mean, she's really a testament to, our genetics play a huge role in
Yes.
our brain health, in our, uh,
Mhm.
ability to stave off chronic disease and things like that.
Yeah,
But, our
we can beat
lifestyle is
it.
huge. Yeah, we can
Mhm.
do things to help ourselves to beat it,
Yeah,
or to avoid it, or delay it.
yep,
And so those are the things
absolutely.
that we have control over. And you could see where Ellen,
Yes,
she decided to take control of the things
yes.
she can manage, and,
Mhm.
that was really, really amazing.
Yeah, absolutely. Yeah, yeah. I've actually done the 23andMe testing, the genetic
Hmm.
testing. So it shows you kind of all that. And I think one of them that came up for me was, at my age at 30, I should be overweight and have diabetes. And I do think I have a lot of family history of type 2 diabetes. So it made sense that
Hmm.
that was showing up. But I was like, wow, how cool is this to see like my lifestyle actually has made a difference,
Yeah,
which
no,
is
that's
so cool.
amazing. Very cool.
Mhm.
And with genetic testing, as far as with brain health, there is a, this APO4 gene, and I think there's an APO3 gene that can be tested
Yeah.
for. And so many people are afraid to be tested because they think, well, I can't do anything about it. But,
Right.
I always encourage people to, if you have any worries about it and you want to get tested, you do have some things that you can do now to, I
Yeah.
mean, and maybe that will be more of a motivator to
Right.
change some lifestyle factors. So yeah,
Yeah.
not definitely a good thing to do.
Yeah. Yeah. It's even that testing and knowing that, right, makes you realize like, okay, now that's something I should be focusing on to
Hmm.
avoid that to happen. Or maybe just a little more focused on that. Like, for me, for example, I also know in genetics, like cholesterol, that's
Hmm.
something that can be genetic, like high cholesterol, and that runs in my family. And I've gotten it, tested before, and I think I was actually in college. So I was pretty young, and it was nearly high, and I was like, what? Like, I
Right.
run, like, and
Yeah.
that was before I was plant based and everything. But I realized, like, maybe, and that's kind of part of probably why I went plant-based, was kind of part of it as well,
Hmm.
that I don't think I talk about a lot, is that I had that genetic of having higher cholesterol, and realize like, "Oh, like, I really need to watch this."
Right, right, exactly. And really,
Mhm.
in when, talking about our diets and brain health, and that's where that plant-based piece comes in. And that's very well researched in brain health that, that if we are including more plant-based foods in our diets, it's great for our brains. And
Yeah.
there's a diet that's been really well researched and studied called the MIND diet. I don't know if you're familiar with it. It's the Mediterranean diet and the DASH diet. So the DASH diet, for those that aren't familiar, Mediterranean is pretty common, and a lot of people are familiar with the Mediterranean diet. And I want to be clear with diet, I don't mean a diet, because a lot of times I'll have clients that, oh, another diet. No, it's a lifestyle, a way of eating, not a diet. Because, as you have said in your group as well, we know diets don't work, right? So the MIND way of eating, MIND diet, is the Mediterranean and the DASH. And the DASH is usually prescribed in a hospital setting for someone who's just had a heart condition or, newly diagnosed or had a heart attack or something like that. And it stands for Dietary Approaches to Stop Hypertension. And so what the researchers did was they looked at the DASH diet, which is really a lower saturated fat, lower sodium diet, and then combined that with the Mediterranean diet to study how did this affect brain health. And really largely the MIND diet is plant-based. And it really is it's a group of 10 foods that they want you to kind of incorporate into your diet, and then 5 foods that you want to limit in your diet. And so nothing is off limits. You're not avoiding or completely taking a food group out or something like that, unless you want to. But it really is largely based on a plant-based diet is what they're finding is very good for brain health.
Wow, that's so cool. Now there's certain foods, like certain plant-based foods that are better for your brain?
So in the MIND diet, they really encourage a wide variety, like eating the rainbow and really those dark, colorful, pigmented vegetables and green leafy greens and things like that.
That as well.
Yeah, so
How
all those
important greens are.
definitely all those phytonutrients. The other one that's really been studied quite a bit too is blueberries. So berries are with the antioxidant content and things like that have been found to be really beneficial for brain health. I think they've also studied strawberries as well, but really the blueberries are what the research is kind of pointing to. And then legumes and eating whole grains, and things that we would find in more of a plant-based diet. And then in the MIND diet, they're really the things that you're limiting are fried foods, butter and margarine, kind of replacing it more with olive oil when you can, limiting red meat. So, and a lot of plant-based eaters are not eating red meat anyway, or they're eating very small amounts. So that's part of it. And then also limiting sugar content, which we know is can be bad on our joints for inflammation and things like that. So I think in any healthy diet, we have to try to limit the sugar, even though it's difficult for a lot of people.
Yeah, absolutely. Yeah. We're a lot of times I think we're kind of addicted to that sugar if we've eaten it for a long time, and it's hard to not not eat it.
Yes, definitely.
Just like salt as well. I think salt and sugar are both of those things. Absolutely.
Yep.
So somebody asked here in a comment here, how long have you been plant-based yourself? So was it before you kind of got into this brain health research?
I would say I've always sort of eaten more plant-based, I just don't eat a lot of red meat. But I definitely feel in the last couple years that I've really been looking at the research that I try to get as many vegetables, leafy greens into my diet more than I ever have. I'm very cognizant of it. So I would say, since I've been studying it, it's definitely helped me to stay on task with it and kind of, I think a lot of times that, as we know, education is power. And if you know why you're doing it, it's much easier to make those choices and to,
Yes.
kind of
Absolutely.
avoid making more of an unhealthy choice. And so that's helped me a lot with doing all this research.
Yeah. Oh, so cool. Yeah. Yeah. Because you've had a greater why, right?
Yes,
To
for
help you.
sure. Yeah.
So
And then
awesome.
the other thing that is really interesting in when I started looking into all of this is looking at the blue zones of the world. So I don't know if a lot of people
Mm,
are familiar with that, but it is really, really interesting to look at these. They're basically places in the world where people live the longest. Many of them, there's virtually no dementia. And it's like, what are these people doing? And it is a combination of things, but it's a lot about what they're eating and their activity levels, and also
yeah.
into socialization and enjoying their food, eating slowly,
Mhm.
sleeping well, having lower stress in their lives, and things like that. So all those things play into brain health and longevity. But
Mhm.
it's really interesting to look at those areas of the world where they're really eating a plant-based diet, and they are living long, and not just living long, they're living healthy and active
Yeah.
into their 90s. So
Yeah.
it's really cool stuff.
Yeah. Very cool. Yeah. So cool. Yeah. Even I think Ellen going back to Ellen last
Hmm.
night, I mean, she's a perfect example. Like, she doesn't look her age at all.
Not at all.
It's amazing what you can do
Right.
to really take care of herself. So,
Yes,
yeah,
absolutely.
so cool.
Yeah, and I think when you see someone who's actually living it like that, and
Yeah.
can talk about it, it's motivating. And
Yeah.
again, that gives you more of your
Absolutely.
why, more information to make those good
Mhm.
choices, because
Mhm.
she changed her trajectory in life, really, when
Yeah.
you looking at her genes and
Yeah.
her family history.
Yeah. Yeah. Absolutely. So cool. Um, Now you mentioned too, I think a little bit about people with injuries and kind of with the mental health side of it. Can you talk more about that?
Yeah, so with that piece of it, I was thinking with runners in particular, or endurance athletes in general, when we have an injury and we lose our ability to do that thing that we love so much, I've just found over the years working with athletes that they kind of just get really nervous about, how am I going to like maintain my weight, and how am I going to like stay healthy? And
Mhm.
I think because a lot of times we sort of, kind of use that activity as sort of helping us with, our health and helping us maintain a certain weight. Um,
Mhm.
so that's the piece where in my physical therapy practice, where I have incorporated that nutrition piece to, when you are recovering, that you do have to, you know be a little more mindful than maybe you typically are when you're burning a lot more calories when you're very active, because you're not going to be as active as you previously were.
Mhm.
And I think a great way to do that is by eating a plant-based diet, because we know that the calories aren't, it's very dense, and you're going to get fuller, you're going to have a lot of fiber, it's going to keep you full longer. And so with the athletes that I work with that maybe aren't eating so much that way, it also helps with injury recovery, because if you have a lot of inflammation, your body is working
Mhm.
kind of double time to heal you. Getting a lot of really healthy things in your body is what's going to help with your recovery. If you're not
Mhm.
eating,
Yeah.
and you're choosing a lot of things that are going to hinder recovery, it definitely makes the road longer and leads to
Mhm.
more inflammation. And it's just a good way to manage weight as well,
Mhm.
when you're recovering. So that's always something I've kind of incorporated, especially with athletes, because it is always a
Yeah.
big concern, when they
Yeah.
can't do their activity.
Mhm.
It's
Yeah, absolutely. Yeah, diet is huge. Nutrition's huge, definitely.
hard.
Now, do you ever work with them as well on kind of like I guess like maybe stress management, because I think that goes along with like the mental health. Because I just know a lot of runners that, I've worked with or that are in this group that have asked me questions about that. And, they're like, well, I run to relieve my stress. Now I'm injured and I'm going crazy.
Right.
What do I do?
Yes, yes, definitely. And, doing things like meditation, I think is great if you're open to it.
Hmm.
And depending on the injury, I have had clients try maybe some yoga positions that aren't going to affect their injured area. Just things that are more mindful and, you know, trying to incorporate those things in because like you said, it is for many people that's how they kind of get their stress out is through their
Hmm.
activity. And so you have to just kind of pivot a little bit and know that I always try to be encouraging that this is going to get better. This is you're on the road to recovery.
Hmm.
But in this time we just have to we're going to learn some new things that maybe you even incorporate after you get back into your activity that you
Yeah.
felt was really helpful with stress management and also all that cross training stuff that we sometimes neglect when we're an endurance
Hmm.
athlete and we're just focusing on our activity. We're not doing a lot of those cross training activities that are good for the whole body and mind.
Hmm. Yeah, absolutely. So it's a good time to do those as long as it doesn't, right, hurt that injury.
Right, right,
First.
exactly. And a lot of times people can work in, strength training that they weren't maybe previously doing, maybe more upper body if they have a lower extremity
Mhm.
injury.
Right.
You can definitely do a lot of core workouts depending on the injury.
Mhm.
So just also finding ways for an athlete to exercise because if they're not
Yeah.
doing any type of exercise and they're so used to cycling or running or any type of endurance activity and they lose all that doing something for their bodies that is not going to cause a problem where they have the injury goes a long way for their mental health.
Yeah. Certainly. Yeah, definitely. Because they're keep it's like a habit, right? So they've gotten in this habit and you don't want to just drop a habit. You want to still continue to do it even if you have to modify it, right?
Right, exactly. And I think a lot of people end up falling in love with, whatever they
Yes.
start doing. Like I've
Mhm.
had runners that now love doing, 10, 15 minutes of meditation or
Yeah,
have
same.
started taking some yoga.
I
Yeah.
started
So,
doing yoga when I was injured, and then I was like, "Oh, I love this." So now
right.
I do 10 minutes of yoga and 10 minutes of meditation, like, every day before I go on my run, and I'm like, I
Oh,
probably
that's
would have
great.
never started doing that if I wasn't injured before, but then I just
Mhm,
realized how I liked it, and I was like, "I wanna try to do both," but I used to just get up and I used to go for my run.
mhm. Yeah,
Now I'm like,
no, exactly.
I
Yeah.
gotta warm up first.
Right, yeah, sometimes the silver lining of an injury,
Mhm.
allows us to step back and really kind of look at the whole big picture and
Yes.
incorporate some of these really great things that are great for, the body, mind, and the soul, you know?
Yeah. Yeah. Exactly. Exactly. Yeah. Yeah. Cool. What was something else I was thinking? Oh, another thing is cooking. I think that goes back to like the plant-based eating. And if you haven't really been into plant-based nutrition, I think a good time is too when you're injured is to start experimenting with eating plant-based and cooking more. I've seen
Oh, yeah.
people kind of get more into that. And I'm like, yeah, that's a great way to be creative and
Yes.
take up time, have time
Mhm.
more than, when you wouldn't really have as much time when you're training. Now you
Right.
have time to experiment with
Yeah,
cooking.
that is a great point because you can focus a little bit more in on your diet, um, because I do have clients that really are not maybe not very good with their diet or very like they rely on their exercise and that's it
Yeah,
and it really does help to bring kind of that focus away and
sure.
say that these are the pieces to how you can manage this and that
Mhm.
same thing where people have really fallen in love with um, eating healthier and
Yeah,
getting enough water staying hydrated and things like that they
yeah,
wouldn't normally have done if they weren't injured.
yeah,
So yeah,
yeah,
really good point.
absolutely, absolutely. Cool. So cool. Let's see. Anything else that you want to share with us? Brain health and
Um,
running. Did we cover it all?
think so. I mean, the only thing,
Okay.
I guess the only other thing I'd say is just that, again, reiterating that, the research is there for, physical activity being
Yeah.
tied to, brain health, just, the blood
Yeah.
flow to the brain. And, that's really the number one thing that has been studied in lowering risk
Yeah.
is physical activity. So
Awesome.
that's where that running piece comes in. And then,
Yeah.
going into, when we're talking about plant-based, it's just, twofold that you really are lowering your risk by doing, both of those things.
Yeah. Yeah. Absolutely. Yeah. Definitely. Awesome. So let's see. Is there like a piece of advice you would give somebody that, wants to maybe start incorporating more of this idea of, focusing on their brain health and that sort of stuff, as well as the nutrition and the running?
Yeah, I would say, my advice would be to look at all the lifestyle factors that do affect brain health. The diet part and the physical activity, and getting that, wide range of physical activity in with whatever endurance sport that you love, that you start incorporating some other things to actually
Mhm.
challenge yourself too, to try something new. And that's a big part of brain health as well, is that we're, our brains are able to create these new pathways and to grow and all those things, especially as we or actually as we age. It still can happen. This
Mhm.
concept of neuroplasticity and how our brains can form new connections and new neurons and all those great things. But we have to challenge ourselves, and I think it's a good way, even in a physical activity standpoint, of incorporating some of those other things like we talked about, meditation.
Mhm.
Lowering stress level is really a huge part of brain
Yeah,
health, and lowering
absolutely.
inflammation through diet. And
Yeah.
because we know that inflammation is a normal part of our bodies. It's a normal part of how we handle things and handle injury. But it's that chronic inflammation that we see with some, diets that are not along the plant-based line,
Mhm.
that can contribute to injury.
Mhm.
um, so I would say that, incorporating new tasks that you wouldn't normally do, or new activities, is huge. Of course, eating a plant-based diet, and then just really, staying physically active is a huge part of it.
Yeah, yeah, definitely. And someone actually just asked if there's any specific type of activity that's more beneficial than the other. So is it just important to get some sort of a movement, or is it better to have endurance versus strength training, or both?
So the research is pointing to a combination of cardiovascular and strength training. And I think that piece of it is, with the strength training, we actually change the composition of our bodies, and that helps with weight management, and helps also with, avoiding chronic illnesses. And so
Mhm.
it is in combination. This brain health training that, I've learned more about, there is still a lot of research going on about incorporating the cognitive tasks while you're exercising. I do think it's
Mhm.
a really neat, cool area, that it just makes sense to me that,
Yeah.
we're getting the blood flow to the brain by doing, some sort of physical activity where your heart rate is going up. And then we're challenging our minds to remember things, or to remember sequencing of exercises. And so incorporating something like that into your routine
Okay.
would be beneficial. But I think both the cardiovascular and the strength training are really what the research is pointing to.
Yeah. Yeah. I definitely agree. There's definitely benefits to both, and
Mhm.
having that balance, I think, is really good. But yeah, it's really interesting too, thinking about, counting and the sequences. I know for myself, sometimes like I'll be doing exercises and I forget the number. like,
Right.
what was I on? Like, I'll be counting, right, to 10, like 10 reps, and then I'm like, what was I on?
Right,
Because my
right.
mind probably wandered or was thinking about something, and I was like, I totally lost count.
Yes, exactly. That's actually kind of a joke in physical therapy because, we'll tell someone to do, 15, but we really want 20. So they're like, no, you said 15. And I'm like, no, you 5 more. But yeah, no, but it's kind of a neat thing to challenge yourself while mentally while you're exercising is kind of a new area, but and it
Yeah.
makes it kind of fun too, it just is
Yeah.
something different.
Yeah, it does. Yeah. Are there any other techniques or strategies that you could share that would help with, why what people could think about or do while they're exercising?
Yeah, so what I focus on because I'm, very concerned with active aging and things like that,
Yeah.
is definitely incorporating functional type of exercises into your routine. And a lot of people hear that word, but they don't exactly know what does
Yes.
functional movement or functional exercise. What is that? What do I need to do?
Yeah.
And so, really, what that means is you're incorporating exercises or movements, I should say, that sort of mimic our everyday daily tasks. So, if you think about through your day,
Mm.
when you have to get out of bed and stand up, or you have to bend down to get something off the floor. I mean, you're squatting. When you
Mhm.
are going upstairs or climbing a hill or something like that, it's basically a lunge that you're doing. And then we do a lot of push and
Mm.
pull type of movements. Pulling open doors, pushing things shut, pulling your body into like the car, pushing,
Mhm.
or pulling the door shut, things like that. And then the other one is there's two other functional movements: hinge exercise, where basically you're hinging at your hips versus rounding at your back.
Mm.
And that's something that, getting in and out of a chair, as a physical therapist, what I see a lot as we age, the pelvis tends to rotate back a little bit and posture changes, and we start getting this rounding in the shoulders. And then that changes how we get up from a chair. It changes our whole center of gravity when we're walking. So
Mm.
incorporating those hinge exercises to really keep that hip mobility, also very important for running. And the other thing is
Mhm.
carrying exercises. So, when you think about when you're bringing the trash out or you have to carry the groceries, you're
Mhm.
incorporating balance, you're incorporating strength and coordination. And so by doing exercises that are doing combination movements instead of, when you think about just doing a straight bicep curl, not a bad exercise. It's great for toning, it's great for strength, but adding in a squat while you're doing a bicep curl would be a little more functional, so
Right.
maintaining those movements. So incorporating the squats, lunges, push up or rows and things like that. And then, just carrying exercises, holding weights, doing, forward hinge movements. Um, all of those can be
Mhm.
really beneficial to keeping you active and mobile as we age as well. So
Yeah.
that would be my advice: is if you're, when you're doing your strength training, that you incorporate some of those movements in, so that you keep your body
Right.
flexible and mobile.
Yeah. Yeah, definitely. Definitely as you age
Yes,
too,
for
right?
sure.
Yeah,
Yeah,
you wanna keep running and keep, keep flexible and be able
right.
to do things later in life.
Yes, yeah. Because
Not
when
be
we
in a wheelchair.
Right. When we talk about fitness, a lot of times it encompasses our balance, our coordination,
Yeah.
our endurance, our reaction time, those kinds of things. And if we're
Mhm.
just doing, one thing and we're not incorporating some of these other tasks, and balance is a huge thing for runners. Is incorporating some
Mhm.
balance activities into your workouts
Yeah.
is great for
Mhm.
for running. Um, and also just for longevity. It's just something we don't realize we can lose these things until you start to lose them.
Mhm.
And I think that's
Right.
the big thing I've seen with patients and clients over the years, is like, how did this happen? I already know, now I feel like I'm gonna fall. Like, how did this happen? And it's like, those are things that you can
Right.
work on now, to try to
Yeah.
prevent them.
Yeah, absolutely. Yeah, just like preventing heart disease or
Mhm.
any other chronic illness.
Yes, absolutely. Yep.
Mhm. Awesome.
Yeah.
Awesome. So cool. All right, cool. Let me see if there's any questions. Oh, Kristen said hi.
Oh, hey, Kristen.
Hey. Awesome.
And she
Cool.
did the one on you guys were talking about strength training too, so
Yes,
incorporating that
we did.
into yeah, so that's
Yes,
awesome.
this ties in really well to that as well. Yeah,
Mhm. Yep,
awesome.
totally.
Yes, I think it is important. So I love bringing, especially my physical therapist in and talking about that importance of strength training and, as you said, functional movement and yoga and just different things that we should be incorporating. I think is so important for our
Yeah.
overall wellness and our
For
health.
sure. Yeah. And, and Kristen may have touched on this, but it just popped in my head
Yeah.
because Ellen was actually talking, and I love how she's such a big fan of physical therapy too. I was like,
Yes,
yes,
I know.
she's,
I was like, oh
yeah.
my Lord. Like
I
I
was like,
love physical therapists too. So it's like,
right. I'm like, oh
yeah,
wow, she's really benefited. That's really awesome.
awesome.
But yeah, so she was talking about, and this is something that I've seen a lot in runners, is neglecting that lateral movement. So like the sidestepping, working your glutes and your like
Yeah.
deeper glute muscles can contribute to knee pain. And so she touched on that a little
Mm,
bit, how she did a lot of
yeah.
core work and bridges and things like that, and hip
Yeah.
work to keep her knees from hurting. And
Right.
that was great to hear that she got a lot of good information, and still it seems like does a lot of those exercises still to keep her
Yeah.
running. So
Yeah.
yeah, that was amazing.
Yeah, absolutely. Yeah, we forget like why we should do those things and why it's important, and
Mhm.
especially if we want to keep running longer in life. I think many people in this group, like, we're not just running to run a race or win a race. It's about running for the rest of our life and staying
Mhm.
active and staying healthy.
Yes, exactly. Yep.
Yeah. Yeah. So cool.
Great way to
Awesome.
do
Oh,
it.
this is so fun. Cool. Any other questions? Does anyone have any questions for Carissa while she's here? All right. Well, if anyone does have any questions, you can always post them in the comments here. I can give them to her. We can tag
Yeah,
her.
and
And
I'll check it
yeah,
out, and yeah.
yeah, yeah,
So yeah,
definitely.
any questions, put them in.
Yeah.
I'll find them.
Cool. Perfect.
All
Perfect.
right.
Awesome. Anything else you want to share with everyone? I think this was great. I love this. This was
Yeah, no,
very, very informative.
yeah, I think we hit all the points. Um,
Awesome.
yeah, I'm in Chicago and it's 21 degrees here, so I'm very jealous
Oh,
of your weather in Florida.
I
Um,
know.
but yeah, I still run in
Or
this.
yeah, good for you.
it is crazy how you see there are still so many runners out that just bundle on up and get out there, and
Yes.
I love it. So
Yeah, yeah, it's so awesome. Yes. Oh,
yeah,
yeah. I'm from New York, so I used to do it. I bundled right up and got out there, but
yeah,
yeah, wasn't my favorite, but I did
right,
it.
exactly. Still, it's possible.
It's still
So,
great to, I think, to get that fresh air and
oh
be
yeah,
outside.
definitely. Yeah.
Yeah, yeah, so awesome. Well, thank you so much. I think
Well,
this was
thank
really, really
you.
great.
Yeah, thank you
Yes,
so much for having me, and
you're
then, yeah, if anyone
welcome.
has any questions, just let me know, and or let
Awesome.
Kayla know.
Oh, yes, one more thing. How can people find you? Do you have
Oh,
social media handles or website?
yeah, so my website is mybodymechanic.net, and then, also can email me if you want it, mybodymechanic@icloud.com.
Okay,
So yeah, that's where I can be reached.
awesome. Perfect. Yay. Okay.
Yeah, thank you.
Awesome. Thank you.
Okay, well, you have a great
Awesome.
rest of your day.
Yes, you too.
Okay, see ya.
Bye.